emergency physicians all over the world. So actually right now it's the evening time and I'm speaking to you from Jordan. And I'm here for the first Jordanian National Emergency Medicine Congress that they've ever had here in Jordan. And there are strong female role models everywhere. You're looking at two of them now that I've just been talking to this afternoon. So there are strong women all over the world in emergency medicine. Next slide, please. So in fact, I actually think that emergency medicine is quite female friendly. I think because as our nature is more team-minded, we do work in a much more equal way. And we do see a lot of female residents and female attendings and consultants, and not just doing traditional things. So you can see me there with a child doing cannulation. You can see another doctor trying to help an old lady on those maybe perceived as the more female ways of working in emergency medicine. But yes, we can fly around in helicopters, we can do resuscitation. Next slide, please. And if you look throughout our practice, I don't know in Latin America how many different subspecialty areas there are of emergency medicine that are widely around. But as well as general emergency medicine, we practice other interest areas depending on what our training is and what our interest is. And we should not see that pediatric or geriatric emergency medicine is for women, or that critical care and academics is for men, or pre-hospital care, flying around in sexy helicopters. That's not just for men, that's for all of us. So we must all remember to remove the stereotypes from our heads. Next slide. There is one area where women are definitely underrepresented, and that is in academic careers. So within the university structures, women are actually very much a minority in emergency medicine. Now, I say that when actually academic emergency medicine is the privilege of the larger emergency medicine, more developed countries. So there aren't very many professors around in the world, but where there are very few women. And one of our board of directors members from the IFEM is an expert in this area and has written some good papers on the barriers to women going higher up in academic careers. Next slide, please. You'll be pleased to know that within the International Federation, we have a special interest group on gender, and we have been writing position statements and running workshops and all sorts of things. The membership at the moment, I think there are about 30 or 40 members, and I'll give you some details at the very end if you would like to join us. So everybody is welcome to join our special interest group. Next slide, please. One of the things that I get asked all the time by younger women, younger doctors thinking of doing emergency medicine as a career is, well, what about the shift work? That must be bad for home life. I'm not sure that it is. I think sometimes it brings a lot more flexibility, but it depends on how the team in the hospital is running the rota. One thing I would recommend to you is, if you can, if there are enough doctors in your department, is to have an Excel spreadsheet and think about your shifts, think about your the way that you distribute the numbers of doctors, and see if you can make that an open document which everybody can move around and swap shifts to suit themselves. Now you can set some limits to it. You can make sure everybody does a fair number of evenings, weekends and nights. But actually, if you let people rota themselves, sometimes you'll find that within a larger team, there's enough variation in people's preferences that it has no detrimental effect on the rota, but people actually start to work the hours they prefer to work or the days of the week they prefer to work. And in our experience in my department, this has made a big difference to morale and a big difference to people's family lives, because they can accommodate for certain parts of childcare or their partner's career, that sort of thing. So have a think about that, if that's actually possible in your department. Next slide, please. Next slide, please. That's what ours looks like. We have all the doctors across the top, We have all the dates down the side, and for the next months, not just weeks, for the next months, we can see what we're doing. And if there are empty slots, we can move the slot around. If there's no empty slot, you can request swaps with your colleagues. And a lot of the time we do keep holes in the rota deliberately so we can move around the slots. So it's just like a puzzle, and we work it out and everybody's happy. And this is what I call, you might hear the phrase work-life balance. I prefer work-life integration, because part of our job is being able to put it to one side. Sometimes we have enough stress in the work that we do that it's sometimes better to try and decrease your cognitive load, decrease your stress, decrease your decision making by trying to make space for work, space for home, space for hobbies, and try and separate things as much as you can. Next slide, please. So I don't know how many of you know Cesar Millan. He's from Mexico, and I think he's great. I watch his programs on dog training, and it is interesting. What he says is that we think of the dog as an individual with behaviors. Actually, what you see, 80% is dog. It's just the way dogs behave. 15% is the breed of dog. We know the breed does make a difference to behavior. And 5% of what you see is the individual personality of that dog. And I think of our human behavior as 80% human, 15% individual, and probably 5% gender. But we must remember it's not all about gender. We do have to keep some things in perspective here. Next slide, please. But there are differences, and it may not be differences in what we do or even the way we think, but it can be differences in the way that we are perceived. Now, I know not everybody listening will have good enough English to see the difference between the left side and the right side here, but a woman is more likely to be called bossy. The man is more likely to be called a leader. A leader is a positive description. Bossy is a very negative description. A woman is difficult. A man is assertive. Assertive is just a nice, gentle way of saying he's a strong person, not difficult. Woman is blunt. That's quite a rude phrase in English. A man, oh, he says it as it is. You know, he just makes it clear. The same, forceful, confident, aggressive, strong, too ambitious, next leader. So we have all suffered these labels. I'm sure you can all identify with this. Next slide, please. But in the end, who wins the long race? Next slide, please. Now, I think most of the women in the audience are familiar with this concept, but maybe not so many of the men. And it's important everybody knows this. It is true that women tend to see things through the world that I know is very small, and other people know more than me. That's the left side. Actually, what I know and what other people know is all different, and other people know different things, and there are areas of overlap. But when you see people who are better than you, you think they're more knowledgeable than you, they're more clever than you. That's a distortion in your mind. So what you know is more than what you think you know. You're just different. Next slide, please. And this is called imposter syndrome. When you believe that you're over promoted, that people are seeing you from better than you really are, and you doubting yourself. And when this happens, then we become too self-conscious. We lack confidence, and then your behavior swings from one thing to the other. So one minute you're being apologetic, the next minute you're taking charge too much, or you're publicly undermining yourself. I'm not good enough. I'm sorry I spoke. I'm sorry to say something different from what you think. Or you can swing to being over-assertive because you think, I'm a woman in a man's world, I have to be strong. And so it's a case of finding that balance. Next slide, please. I will recommend one book to you. I've been reading this book, and this is about finding the balance. It's about finding the balance in your life with your work and your home life. It's about understanding the person you are and the little devils that talk to you sometimes. It is a good book. It's written by I think it's US, could be Canadian. No, it's US emergency physician. So I think that's worth reading because she sees it through eyes similar to us. So beware the imposter syndrome, but it's not, you need to get under the surface of it. You need to develop your own inner confidence in yourself. So it's not all about being female. I think that I would recommend this book to men very much as well. Next slide, please. And in the end, I would not turn to the books so much. Look at other women around you. There are so many good role models, and ask yourself, how would she do this? How would she react? Think about it and copy. Next slide, please. I often get asked, is there a glass ceiling? I don't know if the phrase translates into Spanish and you all know what I mean, but if you look at the women in leadership positions compared with lower down in an organization, we do see in most organizations fewer women as you get closer to the top. And I often get asked, have you experienced sexism in your career? And I actually think at a more junior level, no, not really. And I think that if you challenge a man, or you have a different opinion, or you ask questions, that's accepted easier when you're more junior. And I think as the more senior you get and the more equal you get to the man that you're talking to, or if you're actually above him in the hierarchy, that's when you see more problems arise. And I have certainly experienced more sexism in my career in the last 10 years than I did in the first 20 years, for sure. Next slide, please. So having said all of that, I do want you to remember that most of what our behavior is human behavior, and most of what we are is us as an individual. So let's not get too obsessed by gender. Let's not get too evangelical about gender, because that causes problems itself. But just remember that we are different, and there's a great deal more overlap than there is differences between the genders. Next slide, please. So Daniel, you only gave me 1 week to prepare this talk, so this is what I came up with. I'm delighted to answer any questions. I'm extremely interested to know if the experiences of women in Latin America are different from mine, having been most of my time in the US and the UK in terms of my career. If you're interested in joining the gender interest group within the IFEM, then you can send your request to admin@ifem.cc and just explain why you want to join the group, and just send a copy of your curriculum vitae. And we really welcome new members from Latin America. We don't have enough. So please, please come and join our special interest group. And just remember, gender is only one aspect of you. Don't get too hung up on it. Enjoy your life. You only get one chance.